Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, I am honored to welcome Julia Wood, occupational therapist and the Director of Professional and Community Education at the Lewy Body Dementia Association. Welcome, Julia. How are you?
Doing great. Thanks so much for having me.
Our pleasure. Our pleasure. First, I want to start off. I introduced you as the Director of Professional and Community Education at the Lewy Body Dementia Association. What does that title mean?
So that title essentially means that my responsibility is to direct and handle all educational programming for members of our community. And so that includes people living with Lewy, their care partners, their family members, their friends, neighbors, anyone really interested in our community in learning about dementia. And then also on the professional education end, I'm responsible for directing education that goes to our healthcare providers. So we'll be talking, I'm sure, today about how Lewy is really tricky to diagnose, and a lot of people have a hard time getting an accurate diagnosis and management. And so we're here to make sure that our doctors, our nurses, our pharmacists, our allied health professionals, occupational therapists, and physical therapists like myself learn about this disease, because it really, I think as we talk today, you'll see that the complexity of symptoms really lead to best management being in kind of a multidisciplinary or interdisciplinary team setting. So the more professionals we can have that understand this disease, we believe will really help improve accuracy of diagnosis and also treatment strategies.
That's wonderful. You know, I'm fascinated by the work that you're doing because you know, we own a home care company, and we serve half of the state of Michigan. And we would do a lot of community education, community engagement, provide community resources. And, you know, when COVID struck, we made the conscious decision before the government made it for us to stop with public gathering for the safety of our people and for our seniors and those in our communities. And we started a podcast, you know, and we originally thought we were just going to do it for a few months, maybe a few weeks even, and it led to almost a few years. And so we've had the fortunate ability to speak to people from all over the world about dementia and caregiving and senior care and things related to long-term care in general. And one of the common denominators across the board is when it comes to dementia, people think dementia is a one-size-fits-all. You know, even with our families, Julia, they'll say, well, my mom has Alzheimer's, she doesn't have dementia. You know, you've heard this. I'm not telling you anything you haven't heard before. But then the other aspects of dementia, you know, your Lewy body, the frontal temporal, vascular, those aren't as well known as quote unquote Alzheimer's is thought of as the only form of dementia in a lot of cases. What are the signs and symptoms, the early signs and symptoms of a Lewy body dementia, and how do they differ from those other types of dementia? So people watching or listening that might be thinking, oh yeah, my mom does have Alzheimer's, and maybe it's not, maybe she was misdiagnosed or self-diagnosed. How can they identify those early signs and symptoms?
Absolutely. Well, the complexity of symptoms really leads to a lot of variation for people. So definitely, just like dementia is not a one size fits all, the initial presentation can be very varied as well. So often, one of the things we know many years even prior to onset of symptoms that can happen are changes to sleep for folks. So there's a condition called REM sleep behavior disorder, where, typically in REM sleep, our body goes into a state of atonia where we don't really move very much. Well, when this degeneration happens in the brain, and this is true for people with Parkinson's as well, and some other neurodegenerative diseases, we'll start to see people act out their dreams physically, sometimes wildly, sometimes to the point that they might become injured or fall out of bed, or even, injure a bed partner. We've had some people get punched and the person's completely asleep. And this can happen even, decades prior to the onset. So I think that's one thing that people always want to watch out for that can be a little bit more indicative of a sign of Lewy. Also hallucinations. And what's interesting about the hallucinations in Lewy is we had a doctor give a description one time who now has Lewy himself, that originally he didn't recognize his own hallucination because he would go into his garage and he saw mice run. So the hallucinations a lot of times are very well formed. And to him, this seemed realistic in the situation. Well, one day the mice ran toward him, and that's when he knew, whoa, that's not really happening. That's a hallucination. So the hallucinations are typically visual in nature. People may see animals scurrying up the wall. Sometimes they see people that aren't really there. They're typically well formed, and they might even sometimes have an auditory hallucination that can kind of pair with this visual hallucination where they hear a noise from the item, or maybe the person talks to them. But also, people can have more vague hallucinations too. There's a phenomenon in Lewy body dementia called a sense of presence, where people will feel like something or someone is just over their shoulder. And when they turn to look at it, they kind of see it out of their peripheral and then it's gone. So we see these changes to kind of visual perception and hallucinations and delusions that may happen. Some people may have what we call Parkinsonism, because this is the dementia really related to Parkinson's disease. So slowness of movement, sometimes a little tremor or shakiness. We think about those changes to walking that we see with Parkinson's, where people's feet are more close together and they take smaller steps. Some people, this could be an early sign or symptom, but what's really fascinating is for some people with dementia with Lewy bodies, that happens much later down the road, if ever at all. We sometimes see people with little to no changes to their movement per se. So these are really the things that I think people should be looking out for that are kind of different. And also important to note, the cognitive changes, which are also one of the early symptoms, of course, that people may see, are very, very different than what we see in Alzheimer's, where we typically see changes in language and memory, which is really hallmark of Alzheimer's, right? In people with Lewy body dementia, we see more changes to their executive function. So that would involve things that involve steps, right? Like maybe they're having trouble now all of a sudden balancing their checkbook or doing multitasking at work. Maybe some problems, with direction, visuospatial function can be affected. So maybe finding their way home or wayfinding around. So the changes are much more subtle a lot of times and misunderstood to thinking and memory than what we classically see in Alzheimer's, where we're seeing more of a amnestic or like a change to memory. The changes to memory that we might see with Lewy, because those can happen, are more related to attention. So like if you introduce yourself, but I'm not listening, I'm paying attention to the tray of food that went by at the party rather than when you tell me your name, I'm not going to remember your name, and not because I have a memory impairment, but because I wasn't paying attention. So a lot of changes to attention, executive function, visuospatial function. So little different cognitive changes as well.
Yeah, thank you for breaking that down so perfectly. Now, are there similarities in the early stages or in any stage between a Lewy body and an Alzheimer's?
Absolutely. There totally can be in that. I think if someone is having those attention changes first, and so you start to notice those memory slips, I think naturally, like you said, we kind of think dementia is a one size fits all, and we kind of all think dementia equals Alzheimer's. So I think naturally, a lot of times for clinicians and family members, they might immediately kind of go to that, oh, maybe it's Alzheimer's. But I think that, too, something to keep in mind, and this is something researchers are really looking at now, is there's a lot of co-pathologies they're starting to find. So a lot of people with Lewy body dementia on autopsy also have the amyloids, the tangles and plaques of Alzheimer's in their brain as well. And then people with Alzheimer's may have these Lewy bodies. So I think that science is just now starting to really understand, what this looks like, maybe the clinical presentations, that how that shifts a little bit differently. But it's a very, I think, fascinating time in the science and in the research and helping to try to understand how these conditions overlap, like you're saying, and then how they also differ.
And talking about that, you hear people now say, well, I have mixed dementia. They'll say I have this and this. What presents these challenges in properly and accurately diagnosing Lewy body, and how can the healthcare providers improve that early detection so families get a diagnosis early and also start on treatments early versus getting maybe a misdiagnosed form of dementia or no diagnosis at all?
Right. I mean, that's a really good point. With the mixed diagnosis, a lot of times, and this is really shifting and changing too with the science, for the longest time, clinical presentation was really all we had to go on. So, what that means is you're looking at how someone's symptoms present. Do I have a tremor? Do I have changes to my smell? Do I have sleep changes? What symptoms really am I presenting with? What's really exciting now is we're at a time that there's different types of testing that's emerging with Lewy bodies, especially there's a skin biopsy that they can do where they can actually find the presence of these Lewy bodies. Now, now we're trying to clinically catch up to, I think, what does that mean? How are we going to use that in diagnosis? Because a lot of this testing, as you can imagine, can be quite expensive. It's not widely available just yet. I think it's really picking up. But we have a lot, I think, that you're going to see coming down the pike as we're going into more biomarkers, as we call these, more tests and things that can be done to definitively tell what type of at least protein that person has. And I think that's going to help with clarity of diagnosis. But we're still at a point that the symptoms do matter. So we have an amazing diagnostic symptom checklist that clinicians can use to really look at what the symptoms are that the person's presenting with. On the backside of that checklist, it kind of walks their clinician through the steps that are evidence-based for really diagnosing Lewy. We also, for families, have an amazing comprehensive symptom checklist where you can go through and check kind of the symptoms that you're seeing in yourself or in your loved one and share that with your healthcare team to help inform them in helping you get an accurate diagnosis. So we're still not beyond the place of needing, I think, that clinical piece. So we have to continue to focus on that. But I think there's a lot of emerging science that's going to help in the near future.
Can you, real quick, Julie, could you speak to the self-diagnosing or these checklists or, task, like with Alzheimer's, they say, draw a clock and put the hands here and there. That's entirely separate and specific for Alzheimer's only, or would that apply also to Lewy body?
Some of that does apply. And I would say, though, I mean, this is a really good point that you're making. So the clock drawing test that you're referencing is a great test a lot of times of aspects of executive function, also visual spatial function. So that one I had some really interesting clock drawings through the years with my patients from when I would test. But I would say with Lewy, because there's these different aspects of cognition that can be impacted, this is where a neuropsychological evaluation, I think, becomes more important. So if the person can actually get a proper evaluation from a neuropsychologist, I think this really does help with the differential diagnosis that we're talking about. Because then you're not just looking at kind of like, the clock drawing can be part of like the midi-mental examination or part of the MOCA, but you're just getting a snapshot. And what a neuropsychological evaluation will do is that neuropsychologist can really dig deeper into what aspects of attention are affected, what aspects of memory, really where the problems are. And so we have a great neuropsychologist in our Research Centers of Excellence network, Tanis Furman, who's done a lot of research and is teasing out a lot of the differential presentations like we've been talking about. And I think these professionals can really help a lot if you're kind of on the fence and maybe your healthcare team is not clear. A neuropsychological evaluation can help answer some of those questions.
Great advice. Great advice. We the families that we serve, we tell them, it's good to go to your primary or your internist, but if they're not as equipped or up to date, you want to go see, a geriatric psychiatrist or get a neurological exam by professionals that see these things, day in and day out. But a good place to start is, your family doctor, if nothing else, to get the referral. Alzheimer's was named after Dr. Alzheimer, Some people don't realize that. Lewy body wasn't named after somebody named Louis. It's named after the Lewy bodies in the brain. Can you explain the role of the Lewy bodies in the brain and how they help to contribute to these symptoms of Lewy body dementia?
Actually, though, it is the Lewy bodies are named after Dr. Frederick Levy. So we say Louis. He was German, I believe, and so it would technically be Levy, but it's been changed to Lewy body. And he was actually, my understanding, a colleague of Dr. Alzheimer's. So we have some interesting photos, kind of the two of them together at different points. And I live in the Philadelphia area, and he was here for a while, and I believe is actually even buried in this area. So there is an actual Dr. Louis, but it should be said Levy. But as far as what the Lewy bodies do in the brain, and keep in mind, I mean, I want to say for a caveat that this is definitely, the science is emerging here too, and there's a lot of debate over, kind of, do the Lewy bodies cause it? Are the Lewy bodies kind of an aggregate after there's some other disease? But we do know that the presence of these misfolded proteins of alpha-synuclein that clump in the brain, the presence of that signals what we call Lewy body disease. And then Lewy body disease can be part of Lewy body dementia, which can take the form of Parkinson's disease dementia, where someone has Parkinson's first, and then over time, the cognitive changes for about 50 to 80%, some estimates say, of those people develop dementia over time. For the folks with dementia with Lewy bodies, the dementia or the cognitive changes happen first, or alongside those movement changes to Parkinson's. So then we call that dementia with Lewy bodies. Splitting hairs, you're really seeing similar symptoms, but they kind of pop up and present at different times. So what these inclusions seem to do in the brain is, if you think about, you're going along the freeway and things are going well, and that's how the neurons send a signal, and all of a sudden there's a big accident. We've seen on the news lately all these, big pileups, related to snow. It's kind of like you get a place where the transmission is not able to go through. So they really block up neurotransmission in the brain. Then cell death seems to start. So these neurons that produce dopamine, a lot of those start to die off, and dopamine relates to your mood, your movement, different aspects of a lot of functional things that we need to do in day-to-day life, but also the cholinergic system in the brain. So the system that really helps the brain be alert and awake seems to be affected as well, because one of the hallmarks that we see with Lewy that's very interesting, and I should have mentioned this earlier, these cognitive fluctuations. So when someone 1 minute will seem very alert, very attuned, very awake, and then a few minutes later, or the next day or next hour, they may seem completely zoned out. And this seems to be related to other pathways in the brain. So that's something I think to really watch out for as a sign or symptom as well is, with Alzheimer's, the changes kind of are the changes, and you may see some variation day to day, but these fluctuations where someone goes from alert, awake, ready to go, to kind of completely zoned out is pretty characteristic of Lewy. And I think that's something important for people to look out for as far as diagnosis, and also to understand, because we used to see families that this was so confusing. Well, he could put his shirt on yesterday, or he could, do that a couple of hours ago. Why can't he do it now? And it's a very normal part of the disease where we really see attention and alertness vary and change.
Interesting. Before we move on, if you don't mind, I want to ask a quick question here about Parkinson's, because, and this could be, I don't know if this is a myth or it just varies depending on the individual. And I know there's a lot of factors that come into play, but if somebody has Parkinson's, is it a guarantee that they'll develop Lewy body dementia?
It's a great question. No. We do have people with Parkinson's disease that may not go on to develop the dementia or have much, cognitive impairment. We are learning more and more. I think it was around, 2015 that we had a really solid paper by Dr. Daniel Weintraub where he talked about how these cognitive changes in Parkinson's often happen even early on. And it might be subjective. So the person might do a MOCA or a mini mental, like we were talking about earlier, and totally pass it, but they notice a difference. They notice changes to their multitasking, their attention, being able to, keep track of steps in an activity. And so I think most people with Parkinson's have some level of change to their thinking, even if it's just a subjective change, but not all people with Parkinson's will go on to develop a dementia with it. And like I said, the estimates lately, we've seen 50%, I think was kind of the long-standing one. We've seen up to around 80%. I think that they're still kind of figuring that out. The longer someone lives with Parkinson's, the more likely, of course, they can be to develop the dementia. So a lot, I think we're still learning about these diseases.
And vice versa, if somebody's diagnosed and has Lewy body, does that mean they'll develop Parkinson's?
Right. Like I said, the Parkinsonism, which is kind of what we consider, the hallmark of idiopathic Parkinson's, which is the shakiness, of movement, the stiffness, the slowness. Some people really don't develop very much of that. I'd say most people do. It's kind of rare for them to have no Parkinsonian or no Parkinsonism changes at all. But we have seen a few people like that. It does happen. So good point.
Yeah, I want to talk about the families and the individuals, living with Lewy body. We have several families, they've been diagnosed with Lewy body, and, it's so traumatic, and it's so, it's very sad to see what they and their loved ones are going through, because it doesn't just affect the individual with the diagnosis, right? It affects their spouse, their children, or, what have you. How can people living with Lewy body dementia and their families continue or maintain that quality of life while living with these symptoms and the complexities that come along with a diagnosis like this?
Absolutely. That's a great question. And there's no fantastic answer, but I think the big one is what I advised all of my families that I treated over the years. And I know our amazing support services team at LBDA does is really help people prepare to follow a moving target, because Louis really is a moving target. We talked about those fluctuations and how that can go up or down. They can have good days, they can have bad days. It is still a rather slowly progressing disease, I think, for the most part. But I would really encourage people to think, when you think about the symptoms, like the changes to movement, for example, you want to really start to think at diagnosis. Is my home and I think this is what we all need to be thinking as we age. I'll be honest, as an OT, can I age in place? Can I stay in this home? Maybe like my home right here where I am in Philly, I don't have a bathroom on my main level. We have a bathroom upstairs, we have a bathroom downstairs. So things like that, people I think want to really start to think about, how could I do one level living if I need to? And so considering things like home modifications, or even simple things, putting toilet frames in the bathroom, maybe grab bars in different places, just things to really get ready. I think also getting your healthcare team in place is really important. The symptoms are very complex, and it really does often take a village. So I think, like you said, a geriatric psychiatrist is a great person to have on board, a movement disorder specialist or neurologist, physical therapy, because so looking at those mobility changes, what that's going to look like, having an occupational therapist in your team that can help you adapt as you're having these cognitive changes and visual changes, speech language pathology, because there can be changes to communication, and they a lot of times work with cognition around communicating as well. So really setting up your healthcare team, I think, making sure that you're thinking about your home environment. And then the last piece I would say that you want to do to really be able to, live with this. And like I would tell my patients, I want you to live like you have Parkinson's or have Lewy, not like it has you,
Right.
is to really develop your support circle. So that's different for everyone. Some people love support groups and in-person support groups, where they can really talk with people and chat. Some people, that's not their ball of wax and what they enjoy. So then maybe that's finding podcasts like this, or webinars, or maybe virtual support groups, or things you can go to. But I would say, you can't do this alone. And now what that looks like for everyone is different. Some people just really want to surround themselves with friends and family, and that is absolutely okay. Some people want to connect with the Louis community more, and we're really here to help with that, with support groups and things, as you all do as well. But I think it's you've got to get your healthcare, you got to get your environment set up and be ready. And things like living will, power of attorney, all of those things, that we all have to think about. And then get your circle. What's your community going to look like? What does that mean to you?
Yeah, that's wonderful. Great advice. You know, talking about getting that support, and in a lot of ways, that's just finding hope, right? What are some of the treatment options currently out there for people with Lewy body, and are there any promising new therapies that you can talk about that are on the horizon?
Yeah, that's a really great question. So, for the longest time, I think that where I'm going to start is the treatments have been mostly symptomatic, right? So they can give a drug or some type of therapy to help manage a symptom. So an example might be orthostatic hypotension. So where the blood pressure really drops if someone changes positions. Well, there are medications they can give for that, but also sometimes they might recommend that someone wear compression socks or abdominal binders, or maybe they have you add some salt into your diet. Maybe you get some movement strategies from physical and occupational therapy. So a lot of times there's a medication to help manage the symptom, but then also these, other therapies you can do. At this time, there is no disease modifying therapy or treatment or cure. So there's not a drug that someone can take that will lessen or, slow progression or cure the disease. But you mentioned, is there anything exciting on the horizon? We just had a recent drug trial that came back. There's information about it on our website. This is very early, but there's one disease modifying agent that they've looked at that seems to have some promise. And so they have to do more studies now and really dig in. But they're just like we're seeing some of the trials in Alzheimer's, where they're looking at doing some disease modifying therapies, and some of these look at lowering the amyloid or targeting different aspects of the disease. We're starting to see some of those trials in Lewy, and people looking toward doing those therapies. So I think this is going to be an area of more to come in the future. And so I would encourage you, if you're interested in research about Lewy body dementia, we have an amazing resource called our Lewy Trial Tracker, where you can go on our website and sign up, and there's no obligation. By signing up, you just agree that we can send you information about research on Lewy. But then also, if you want to be paired with studies, we'll take your information, and then that way, if something comes out that maybe you would be a candidate for, we have a fantastic study right now that we're partnering with Rush University in Chicago that's for care partners, and they're doing a peer mentor care partner program. So it's not always drugs, even. They match up a care partner who feels they're more seasoned, or maybe a former care partner, and they mentor someone who feels like they need someone to talk to and need some guidance. And so we're seeing some great partnerships like that, and approaches come out of some of our research centers of excellence. So I encourage you to check out our website and get kind of dialed into that Lewy Trial Tracker so you can find out more if you're interested.
Oh, absolutely. And we'll have all of this up on the screen for our viewers and the listeners. I'm just going to say the website is lbda.org. A lot of great information up there. We'll have it up again later in the show. You have the Lewy line, which is 1-800-539-9767. Is that answered 24/7?
It is not. So we believe our people should sleep.
Of course.
So it is on. We do, got an answering system to it, and so you can leave a message, and they'll call you back between 8 and 5, I believe. And there's also an email option. So if it's kind of late in the middle of the night, you don't want to leave a voicemail, you can email support@lbda.org. So they are really good about getting back to you. We have two amazing licensed clinical social workers who handle our Lewy line. And so that when you call in or email and that person gets back to you, that they're going to very knowledgeable and very compassionate and ready to help you find what you need for support.
That's wonderful. And I know we kind of mentioned some of these things just now, but what are some other options for care partners and family with a loved one to find support for themselves while also taking care of their loved one with Lewy body?
Absolutely. Well, we have some great resources. I'll start with us. I'm going to toot our horn a little bit. We have a community webinar series that we offer annually. So we're about to start that next week. And we have about one webinar a month on different topics related to symptom management, different tools for your toolbox. We've had physical therapists on, occupational therapist, optometrist, ophthalmologist. So we try to share as much information and resources that way as we can. We also have a fantastic free learning, kind of on-demand learning site called our Lewy Learning Center, where you can access courses in different topics about Lewy body dementia and kind of watch them and rewatch them in your own time. And important to note, if you haven't seen our webinar series before and you're looking for information on it, you can go to our YouTube channel, LBDA TV, to find the recordings of those past webinars. So that kind of starts with some things that we have to offer. We also, you can go on our website and look under our support tab at lbda.org, and you'll find local support groups too in your area. So you can put in your zip code and see what's available to you. There's virtual support groups, there's in-person support groups, but a lot of options that way. And also on our website, you can find our research centers of excellence, which are mostly, I would say, in kind of coastal areas. They're kind of tied to these academic medical centers, but we're definitely trying to expand that network. And those settings and sites often have support groups and support options that you can find out about as well. And I think it's always important too to see, what's going on. And, the Alzheimer's Association has support groups. The Parkinson's Foundation, they have great resources that you can check out as well. It really takes a village. And I think a lot of times with things like this, it's finding where you're comfortable and the types of resources that really speak to you and that you're looking for. But I encourage people to really explore. There's so much now out there, and online art programs. There's a great program here in Philly called Arts Philly, ARTZ, where they have these virtual art programs for people with dementia. So, lots of resources. And that's another thing to note too. If you don't want to do an exhaustive search, you're really busy, you're a worn out care partner, that's something when you reach out to our Lewy line and talk to Brandy or Tori or our support services team, they can help curate some resources for you and help you find more what you're looking for and take out a little bit of the legwork.
No, that's a great suggestion. And, you mentioned the art. 2 years ago, the Carnegie Institute in Philadelphia, or it was Pennsylvania, maybe it was Pittsburgh rather, I'm sorry. They had reached out to us because they were just starting a whole new initiative for families with loved ones, with long-term care issues, dementia, Parkinson's, different things, and their caregivers. And it was called the Mindful Museum. Are you familiar with this?
No, that sounds fascinating.
It is very fascinating. They set up the whole museum during certain hours for caregivers and their loved ones. And so you'd go around to the different art exhibits, and, museums, you're supposed to stand and look and, take in the art. They would set up seating at all the exhibits, but then they also had exercise programs for people with disabilities. They had caregiver support groups, and it was the first of its kind in the nation. And we were very, very fortunate to be able to share that for the first time with people. But, it just shows how all of these different areas, they really are targeting, supporting loved ones and their caregivers through these difficult times. You mentioned, I think about an elderly couple whose children may not live locally. They might not be tech savvy. So they're needing to find things that they're comfortable with using and familiar with. And there's all of these different areas of community it just coming together to help support family caregivers and their loved ones. So there's usually something for everyone.
To your point, something I forgot to mention, and I would be kicking myself if we ended the podcast and I hadn't said, check out your dementia-friendly communities too. Yes. A lot of those, I help with the dementia-friendly PA, Pennsylvania initiative, and a lot of great community resources, people really coming together in different areas and communities to make sure that they have resources and programs and things available to make their communities dementia-friendly. So I think there's a lot. I know I get a little excited and bubbly about it because I think there's a lot going on. We're having more awareness around different types of dementia. I think more awareness of, the types of services that people need, the guide model that's coming out with CMS. I think none of it's perfect yet, but I think that all of it is showing that there's a renewed, interest and need for support.
Absolutely. And, Julia, you mentioned nothing is perfect. But if you look 5 years ago, 10 years ago, 15 years ago, we're working towards perfection, right? And it may never be perfect, but we're always rolling out new support services and resources for these families and their loved ones, which, I don't know if we could ask for anything more than that.
Oh, for sure, for sure. And I would encourage you too, because there's such an overlap with Lewy, like we've talked about, in Parkinson's, is I think that it falls in this line of middle spot where you might find resources with, dementia-friendly communities or Alzheimer's Association or Alzheimer's organizations. But then also, like I said, in our area, we have a great what is the name of it now? I'm completely blanking, but a choir for people with Parkinson's. And there's a lot of areas, so that works on the vocal volume. We had a great program, like we were talking about, with the arts, with a museum here too. So I think looking to both those programs for dementia, but also those programs for Parkinson's, a lot of times our folks with Lewy can find a little bit in all of that.
Absolutely. And kind of staying with the theme that I started with, an elderly couple, because we see this so often where, you're working with the children or family long distance, or they can't be on site, and, there's paperwork and, being able to give a history and different things that can present some issues. How can care partners and the healthcare providers work together to create that comprehensive care plan for a loved one living with Lewy body?
Absolutely. I think that's a great question. And I actually just navigated a lot of these challenges in my own family recently. And I think that, one thing for adult children that can be really helpful is if you can, sign your parent up in, the medical portal, like, whatever their online health system portal is. And I know for me, that's easier for me to communicate with the healthcare team for my parents than it is. I'm not there to go to doctor's visits a lot, but we did also have some telemedicine visits. Telemedicine is still allowed in some areas. And so, you might say, could we have a family visit, and do a telemedicine. Also, there, allied health providers, so OTPT speech, there are now some codes for them to do some care partner training. So I think sometimes, and care partner, that could be anyone. If you're, as say, an adult child, you're coming and staying sometimes with your father or mother, and helping out, then that's where I worked with a lot as an OT, a lot of family members, and training them how to transfer someone maybe, or how to assist them, how to help with, different activities of daily living without taking over and just doing it for them. So I think that there's ways for you to interact with the healthcare team if you're at a distance, via like an online medical portal. Maybe have some telehealth visits. Maybe if you're going to visit at some point, try to coordinate. That's what we would have a lot of times. The adult child would come and visit. They would come to our clinic and have kind of a session with OTPT speech, kind of be there for those therapy appointments, be there for those medical appointments when they could, to get more information. But I think that is, I don't want to oversell that it's easy, because it's not. It's very complex. And sometimes, if possible, bringing in the services of like an aging life care manager can be really helpful. So someone that can kind of be in the area that your loved one is in and act as kind of a navigator between you and them. We do a lot of work with the Aging Life Care Association, and know that a lot of times those family members can be, or those services can be really helpful for family members working at a distance.
The great advice, Julia. I want to talk about a word, and it's a word, but it's a service that often gets misunderstood, or there's a lot of misconceptions about what it means and what it entails, and that's hospice. Is hospice a resource that folks living with Lewy body could benefit from, and how does it differ from really like other illnesses that may use hospice care? What kind of, what can you explain about that? Because families, I feel like often when they hear the word hospice, they're immediately thinking death, funeral, horrible things. But that's not really always the case, though.
Right, right. We've done, some education, and we did a webinar with the International Neuropalliative Care Society about really involving palliative care, at diagnosis and early on. So really then that is shifting that focus onto quality of life and also onto the wants and needs of the patient, so we're not really trying to, with palliative, extend life or prolong life, but help support quality of life as much as possible. So I think that having that early on, and I think that gets confused a lot of times with hospice as well. So I think at diagnosis, palliative is super important. And then with hospice, I think that definitely there's going to come a point in time, a lot of times for people with hospice. And one of our amazing clinicians at the University of Florida, Dr. Melissa Armstrong, did a survey of families, and she did find that people get hospice, but a lot of times really late. And it wasn't brought up a lot of times by their healthcare provider. So I think that this is something to not shy away from initiating a conversation with your doctor about how do we know when it's time for hospice. As you can imagine, I think we talked about Lewy being a moving target. It can be hard for clinicians and for families to know when. But I think you're right. That's something to not shy away from. It's really comfort care, and helping the person's wishes be acknowledged and heard, and also thinking more of, where you want to be as you're navigating toward end of life. I will say I'm not hospice expert. So as far as the differences in how hospice is for people with Lewy versus other diseases, the main thing that I know is that it can be really hard to tell when to institute hospice services. And I think that's why just really starting those conversations with your doctor fairly early, when you're comfortable about kind of how do we know when. We have an amazing webinar too last year that's archived with Dr. Melissa Armstrong talking about kind of what end of life in Lewy looks like. Because another thing this brings up where some diseases and dementia, you may have stages, so you more know what to expect. We don't have that with Lewy. So it's not like your doctor can say you're at a stage 4, so it's time to think about hospice. Lewy is really all over the map. It's very different for people as far as trying to tell how it's progressing and what end of the disease looks like. So I think she does a great job in that webinar of explaining what she sees and kind of what we see in the research. But it is definitely not an easy or simple task. So I think the big takeaway that I feel like I glean when I look at the research and listen to doctors like Dr. Armstrong is that you will likely have to initiate the conversation. And what I noticed, like with my parents a lot, is they feel like, well, if the doctor thought it was important, they would talk about it.
Very true.
And so one thing I think is really important to remember is, I hope people can really shift and start to think of themselves as, a consumer in healthcare. And then you need to advocate for your wishes and for what you need. A lot of times the doctor might be uncomfortable or maybe think you don't want to talk about it. And so if you haven't brought it up, maybe they're not going to bring it up. So I think that, something I've learned both in my daughter's healthcare, my family's healthcare in recent years is you have to kind of advocate and ask those questions and bring those things up so that you can have those conversations.
Absolutely. And that's great advice. We kind of, to piggyback off of your answer, we tell families, don't be afraid to ask questions. They don't know you have a question unless you ask it. And oftentimes if you don't report any issues or anything, they think everything is status quo. So, if you're not able to bring an advocate with you that, can either help take notes or, act on your behalf. So that's great advice, Julia. I want to kind of stay with, resources too, because, families don't know what they don't know, and that I think it's not their own fault. They don't ask for this. They don't know what they don't know. And so when they're given that first diagnosis, and our friend Ian Kramer, I use this all the time. He says it's basically diagnose and adios most of the time. You get that diagnosis and that's what you're left with. Can you share some of the ways in which families and individuals living with Lewy body can utilize resources at LBDA for support?
Absolutely. I think number one, we have a lot of people who reach out and maybe they're questioning, if they have Lewy, maybe they've noticed some symptoms or they've had an initial visit with a neurologist and there's some questions being asked. I think making that call to our support services team or that email to kind of say what should I do now, what resources do I need. That way, there's so much information out there, there's so many resources out there. You could spend days and weeks on websites and reading downloads and things like that. And I think what they do a great job is really pointing you toward what you need to know right then. We do have a great packet for families and care partners. You can reach out online and we can mail this to you. We have a great brochure called New to New to Louie. Or Is It Louie? So for those people who are, wondering, is this Louie or is it Alzheimer's? It's a little trifold brochure that goes through kind of, the symptoms and how it's different. We have a great booklet called Facing LBD Together that kind of walks through, now that you're diagnosed, this is really the one you're talking about. Now what? What do you do? And I think at that point, then looking, I would see, how do I establish my healthcare team? Like I said, I think that's when you talk to your doctor. Can I get a referral to allied health services? So PT, OT, speech, so you can get those people in your team. Social work is always great to have on board if they have a social worker in with their clinic at all that can help you. If you're having changes to mood or psychosis, getting that psychiatrist maybe in the mix as well. And then I think you have to really look at, um, what brings you joy, and how are you going to stay engaged in those things that are joyful and meaningful. So that might mean then you're looking at, if we have some people that are really passionate about giving back to research or giving back in some way. So we have a program where we train research advocates. So you could reach out and be part of that. We have a great volunteer program. So sometimes people want to volunteer. So I'll have them do panels, where people want to get the lived experience, or go to a Spark event and speak and give a little presentation. So you can volunteer, I think, if you want. I think once the dust settles and you feel like you've got your feet under you a little bit, I think finding ways to engage with meaning and purpose are really, really important. But then we also, have a lot of just educational opportunities as well for people. So like I said, our community webinar series, our website has a lot of great information, our Lewy Learning Center. And I think learning as you want to, kind of understanding the different aspects of the disease as you go. And getting ready for that. A program that we'll be launching this year is a pilot, so don't get too excited. It's just going to be in one location to start. Is going to be our New to Louie program, which I kind of tipped off a little bit earlier, where we're going to start actually having more resources and support specifically for people who are kind of newly diagnosed. We do have a Facebook group for those newly diagnosed, so that's something our support services team could point you toward. And then I think it's just really looking at, how do you want to live well with this disease? And how do you want to take advantage of the resources? We have tons of resources for doing, education, pickleball tournaments, different fundraising, volunteer opportunities, but it's really what fits for you. And I think trying to navigate the resources we have to fit them within what's going to be best for your life. Our support services team is always there to help, and we're always here to try to find whatever you need.
That's wonderful. Before we close out, I just got a couple more questions, if you don't mind. Sure. One, Julia, could you go through some of the myths that kind of maybe they really grind you when you hear people say them about Lewy body, and dispel them?
Yeah. Oh gosh. The one that kind of breaks my heart is that they're not really there anymore anyway. Mm. It's just like the person's just not there. That just, I can't tell you how much that gets under my skin. Or we had a comment at one point of someone, it's like, well, that's like they're a child. Like you wouldn't say that to a child. They're not children. They're not there. They're still fully, they're an adult who's lived a full life, who has experiences and a richness. I'll give an example of how that really gets my goat. Is one time we had a patient in our clinic who was an amazingly talented artist, right? And so he was having some aphasia and issues with his speech, and our speech language pathologist was having him name like pictures of like cows, pigs, and sheep. I mean, it looked like a worksheet you would give a child. And it really got under my skin, just like you said. And I was like, he's not a child. This man is a genius. And so I sat him down and showed her how he could tell me the difference between a Renoir, Van Gogh, and a Cezanne. That's what he wanted to name. That's what meant something to him. So I think always remember that dementia is a disease. It's not a personality trait. The person is still there. And we have the responsibility. There's a quote I wish I could remember right now. We have the responsibility to connect and communicate with them. That's on us, and it can be done. And so I think don't discount people, don't assume that they're not present, that they're a child, and I know this is hard to see your loved one change. I've had, family members and friends who have gone through this, and I know how heartbreaking it can be, but still see that person is in there. Another belief that gets my goat that can happen, and this is more in the Parkinson's community, but it ties in with Parkinson's disease dementia, is sometimes people believe that the longer you take the medications for your movement, the less effective, like they lose efficacy. It's not the medications that change, it's your brain. So as those neurons are dying off in the brain, there's less of them to uptake that neurotransmitter that they're getting from the medication. So it's a natural part of the disease progression. So don't not take medications because you think that the longer you take them, they won't work. It's something to have a conversation with your doctor about when is the right time to start those medications. But that's something that still really bothers me. And I've seen people get very disabled because they refuse to take the medication, where if they would just take the medication, they could have still worked or, done things they wanted to do. So those are kind of the two big myths. With dementia, they're still there, still talk to them like a human, connect with them, find them, and when it comes to medication, don't believe what you read online. Talk to your doctor, get information, educate yourself about treatments. Don't believe the hype, because there's a lot of it out there when it comes. And also this, one last thing I'll say, I think this entire, community with Parkinson's, because it is the second most common neurodegenerative condition after Alzheimer's, is a big target for kind of scams, supplements, coconut oil, that kind of stuff. Buyer beware. So just really watch. I think there's a lot of predators right now out there trying to get money or trying to solicit, so just always talk with your doctor, have your healthcare team that you can talk to our support services team, ask us a question if you need, but just know that I think there's really good information and advice and resources out there. And then sometimes, unfortunately, there's some predatory ones as well.
Well, I want to piggyback because I was going to actually ask you that next. When people are sitting at home and they're researching and trying to find resources and things, they're on Google. And as you just mentioned, and we say all the time, not all information is good information. How do you suggest or recommend or advise people when they're doing that to differentiate between, okay, this is legitimate versus illegitimate? How, just call you, ask, like what's your advice for people that like to kind of search the internet for answers?
I think you always want to consider the source. So I think that, number one, places that you can go, the NIH, the National Institutes of Health, NIA, National Institutes of Aging. A lot of times those sources, even NINS, the National Institute of Neurological Diseases, they will point you toward national nonprofits or other nonprofits that are disease-based to get more information that are reputable. So I think those are great places to start. Also, your national nonprofits like ourselves, like LBDA, like the Parkinson's Foundation, like the Alzheimer's Association, that are vetting their information and making sure that people are getting accurate information. I think you want to stay away from, or be careful, stay away from necessarily, be careful and be cautious of blog posts. So if someone has just put up kind of a blog, or if it's a private or independent website, just like if I had my own website and I'm saying I've got this vitamin that cures Parkinson's, like I tell people, there's some books even online that I saw, and I'm like, if this were true, it's like I would tell my patients, they would have won the Nobel Prize. It wouldn't be in some obscure corner of Amazon that you're trying to order this. Like, we would have heard about this. So I think really, really consider the source. And if it doesn't come from one of those vetted resources, I would say it's always up for question. We do get questions sometimes on our Lewy line where people will be like, oh, I saw this. Do you think this is legitimate? And sometimes we'll be like, this doesn't seem to be, credible or evidence-based, or, we can chime in sometimes, if we feel like it's appropriate. But I think go to the big guns first, your kind of national institutes, then go to your national nonprofits, and really, kind of also use that I think we all get excited if we think there's a cure or a treatment, but really use critical thinking.
Absolutely.
If someone had found a cure for Lewy body or for Parkinson's, you wouldn't be finding it in this tiny little book on Amazon. That would be major news.
Their name would.
So,
Yeah.
yeah.
Last question, and thank you again, Julia, for taking the time to talk with us today and for all the just tremendous work you guys are doing at the Lewy Body Dementia Association. My last question is for you. What has been the most rewarding and meaningful situation, outcome, result that you've personally experienced in your career with LBDA?
Oh my gosh. Okay, so with LBD, I guess my mind kind of went back immediately to clinical care as well. But I would say, what's been really rewarding for me with LBDA and makes me excited every day to get up and do what I do is, I always loved that one-to-one therapy of getting to help see people become empowered and take charge and a lot of times um gain like this silver lining to the cloud. You know what I mean? Like maybe they hadn't really been doing things they loved or spending time with family. Now they have this renewed vigor for that. And I think now what I get to see is I get to do that on a bigger level even. So before it was one family at a time or one person at a time, the we get amazing comments in after our webinars about how much people learn from that, or they took this to their doctor and they learned they got a new treatment and now they're managing their symptoms so much better, or people that really feel like they have found a community there and found things to do. So I think that's really what touches me most. And our webinar series this year really touches on that, of looking at how do we empower and give people the tools for self-efficacy, for them to be able to find resources they need, take these resources and this education that we're giving them and use it and move forward and really drive how they want to live their life with Lewy body dementia. I think that's what means the most to me, is feeling like I give people a sense of autonomy and hopefully empowerment.
Well, and I will say another thing, just from an outsider's perspective, that I think you and LBDA are doing is you're letting people know that they're not alone. I think that is so vitally crucial. There's all the studies about isolation, loneliness, the years with COVID and the effects that it can have on people. Now, on top of that, you or a loved one are dealing with, Lewy body, and you feel like you're the only people in the world, and you're here and you're providing them with that support and that, counseling and resources. I think that just has a priceless, benefit to the countless families and their loved ones. So I thank you guys for what you're doing, and we'll have the links and everything in our show notes, and we'll be sharing this, and hopefully you'll just reach more people and benefit countless peoples for the years to come.
Absolutely. Thank you so much again for the opportunity.
Our pleasure. Have a great day.
You too.
Thank you for joining us here today at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Julia Wood from the Lewy Body Dementia Association. Thank you so much, and we look forward to seeing you again here at All Home Care Matters.